As I've shared in past videos, I'd been working towards early retirement for most of my career. I'd been saving aggressively and living frugally with the goal of retiring in my early 50s. But when that point arrived, I still felt trapped in my job, and health insurance was a big reason why I felt trapped in that job. I had excellent health insurance from my employer, and the prospect of leaving the security of that solid plan really made me nervous. And judging from comments I've received on my past videos about health insurance, I know this is a big concern for many of you. Early last year, I heard about CrowdHealth on one of my favorite podcasts, and soon thereafter, I was talking to a self-employed friend and learned he had been using CrowdHealth for over 3 years. My goal for today's video is to encourage you to explore all health coverage options, and don't let health insurance be the reason you miss out on the joys of early retirement. I'm Michael, and this is b-tirement. Before I explain how CrowdHealth works, let me take some time to explain why I believe the current health insurance system and the Affordable Care Act are totally broken. When the Affordable Care Act was originally proposed, the claim was that it would reduce healthcare premiums by over $2,500 per family. But in reality, since it took effect in 2014, premiums have nearly tripled and deductibles with the plans have more than doubled. Prior to the ACA, the median premium for an individual for a silver plan was $232 per month. The very next year, that premium increased by nearly 50% to $346 a month. And now that same plan for an individual costs $625 a month. That's an increase of 169%. But premiums don't tell the whole story. In that same time frame, deductibles, or how much you have to pay out of pocket before insurance kicks in, have also increased significantly. In 2014, the median deductible was $2,425 per year. In 2026, that number is $5,304. That's a 119% increase. And here's why I believe those increases are happening. The incentives for the health insurance companies are totally broken. The Affordable Care Act includes a provision called MLR, or Medical Loss Ratio, and this specifies that insurers must spend 85% of the premiums that they take in on paying out medical expenses. This effectively means that their profit and administrative costs are capped at 15%. It might sound great to put a cap on how much an insurance company can profit. However, it totally distorts their incentives. They have no incentive to reduce healthcare costs and reduce their premiums. In fact, their incentive is to continually increase their premiums. If they raise their premiums and pay out more in medical expenses, they can also earn more profit. And this doesn't just affect Affordable Care Act plans. The plans that your employers are paying have also increased in cost dramatically. And if their costs increase, at the end of the day, it means you're earning less than you otherwise could. The healthcare system is totally broken and ready for disruption. But here's the good news. America has a solid track record of upstart companies rising up and taking on bloated and ineffective industries. For example, Netflix disrupted the DVD rental industry. Uber took on and challenged the taxi industry, and Amazon totally disrupted retail. I believe that CrowdHealth is in a similar position. It's an upstart company with an innovative approach, and they're taking on their traditional health insurance industry. And I believe their approach is a great benefit to early retirees. First, let me say that this video is not sponsored by CrowdHealth. I've been a CrowdHealth member for 2 months, and so far it's been great, and I'm going to continue to share my honest opinion as time goes on. I will share a referral link in the description below, and if you do your research and find out that CrowdHealth is right for you, and you use the referral code b-tirement, you'll save on your first 3 months of CrowdHealth and support this channel. Now let's walk through how CrowdHealth works. We'll start with how much or how little it costs, and then we'll dig deeper from there. On the CrowdHealth website, which is joincrowdhealth.com, they have a very good membership price calculator. Let's walk through a couple scenarios. First, let's walk through my scenario. My wife and I are both under 55 years old, and we have 2 college-age children. So I enter 4 people and 0 over the age of 55. The result is a monthly total of $660 for our family. That's the maximum that I'll ever be expected to pay per month. Of that, $60 or $240 for the family is the advocacy fee. This is the amount that goes directly to CrowdHealth for their administrative costs. The remaining amount, $420, is the contribution amount. This is the amount that I'm expected to pay, if needed, towards paying the bills of other CrowdHealth members. Likewise, when I have bills, other members will contribute towards my bills. By comparison, the quote that I got from a major health insurance company for our family coverage for 2026 would have had a premium of over $3,000 per month. A single person under the age of 55 would pay just $200 per month. For each member over 55 years old, their contribution amount is increased to $280 per month. CrowdHealth is not an insurance company. It's a platform that facilitates and empowers members like me to take control of our healthcare and share our medical bills with other members of the crowd. For those of us that have decades of experience with traditional health insurance, it takes time to grasp how this works. But once I did, my mind was blown. CrowdHealth is best for people that are generally healthy. As a starting point, there are a couple restrictions. You can't join CrowdHealth if you're overweight or if you're a smoker. Also, if you have a lot of ongoing health concerns or you're on expensive medication, CrowdHealth likely isn't for you. Consider my situation. I'm relatively healthy and my ongoing expenses are quite low. I see my primary care physician once a year for my physical and my blood work, and then I see a specialist once per year. I'm on one prescription medication, which is a generic, and it's quite cheap. So let's assume that each of those 2 doctor visits is $300 each, and my medicine costs $100 per year. That's only $700 of expense every year. I don't need insurance to cover that $700 per year. I need coverage in case I break a leg or I get diagnosed with a disease, and CrowdHealth perfectly meets that need. At a high level, CrowdHealth members pay our medical providers directly, and if we have an expense that's over $500, we can upload a receipt through the CrowdHealth app, and CrowdHealth will facilitate crowdfunding for that request. We're responsible for the first $500, but then the crowd funds the rest of the bill. So if I get the flu and I go to the urgent treatment center and the bill is $150, I just pay that. But if I break a leg and the bill is $5,000, I'm responsible for the first $500, and then CrowdHealth facilitates crowdfunding the remaining $4,500. For example, they might ask 45 other crowd members to each chip in $100 to pay my bill. In addition to that, each CrowdHealth member can submit one annual wellness event, up to $300, for funding by the crowd. This would typically be your annual physical and blood work. So up to $300, that is totally covered by crowdfunding. If you want to learn more about how CrowdHealth works, I encourage you to check out their website at joincrowdhealth.com. They have a great FAQ that answers a lot of common questions. But if you still have questions, you can schedule a call with one of their experts. We did that, and we left that call convinced that it was a perfect fit for us. If you decide that CrowdHealth is a good fit for you, you can use the referral link in the description below or the referral code b-tirement. You'll support this channel, and you'll also save on your first 3 months of CrowdHealth. If you like this video, please check out my other videos and consider subscribing to the channel. I'm putting out similar content every single week.